I was thinking I'm gonna make 40 the new 30 and all this.
Welcoming a new decade with optimism, Felicia Weisenhunt had no idea she'd soon find a golf ball-sized lump in her breast and receive a diagnosis of stage 3A breast cancer.
It was just so unexpected. I'd had my first mammogram at 35. Everything was fine, and again, I never had any family history that I knew of.
Genetic testing confirmed Felicia had the BRCA2 gene mutation, giving her up to a 49% chance of developing breast cancer and an 18% chance for ovarian cancer.
On those BRCA patients, they need, in my opinion, mastectomies to prevent even further cancer in their life or recurrence of a cancer.
Felicia faced 8 rounds of chemotherapy, a double mastectomy, and a full hysterectomy.
I felt like everything womanly about me was being ripped away.
Followed by months of radiation and participation in a clinical trial of oral chemotherapy.
Some of the doctors told me, if you qualify for any of the clinical trials, because this is a research hospital, you should do them because you have a whole extra set, a team of eyes looking at your case. It was just, my husband liked to call it an insurance policy. Even if the other chemo could have gotten everything, then just think of this as, he would say, an insurance policy that wouldn't be the normal standard of care.
After treatment, Felicia underwent a breast reconstruction with a flap surgery.
Flap is any tissue in our body that is connected by a named blood vessel. So flaps can come from different parts of the body. In our case, as a breast reconstructive surgeon, we use flaps such as fat and skin and tiny little blood vessel that we take away and essentially transplant that onto the chest to make a breast.
Even as my body changes, my breast would change naturally. This is your own tissue.
Throughout countless visits with her care team,
I can't even tell you how many.
Felicia donned a uniform that purposefully blended femininity and strength.
I had these crazy spiked shoes that I brought, and they're these huge blue with spikes all over them so you could kick cancer. And I would wear those to my appointments and wear those and, wear a Wonder Woman shirt and just tried to do whatever I could to be positive about it.
To minimize her risk of recurrence, Felicia will take an estrogen suppressant for the next 10 years. Otherwise, her treatment is complete and she's embracing her 40s with a little bit of sparkle.
I go to school as a teacher with glitter on me, and I'm probably over the top feminine now. But I just feel like, you should carpe diem and live each day to the fullest and do what makes you happy.